morning, ladies. Good morning, ladies and gentlemen. Thank you very much for finding time so that we can do this together this morning. I have a statement that I intend to deliver, a short statement. Fellow Kenyans, I address you at a time like no other time in our memory. This year's Easter is going to be drastically different in many significant ways, but it's a message that remains the same. After the trial, sorrow and gloom that comes with the crucifixion of Christ on Friday, there is assured hope that rises with the resurrection on Sunday. Our current situation has brought us its share of tribulations and heartbreaks. But what a better time for us to consider our blessed hope in the Almighty God for the assured victory ahead. We are in a new place, confronting a situation that is wholly unprecedented in our time. We have never been here before. Our children are out of school. The favorite matatu and boda rider, reliable mama mboga, that dependable barber and saloonist are all facing serious challenges. Our airline industry is grounded. Hotels have shut their doors. We can no longer attend places of worship as we always did. This is phenomenal. And the cause of all this is the novel coronavirus, a minute fragment of inert genetic code. Fortunately for us, defeating this virus, which has occasioned so much suffering, mayhem, and disruption on a scale never witnessed in recent history, does not require the nuclear bomb, mighty armies, or jet fighters. Simple behavioral and hygiene measures, such as avoiding handshakes, washing hands with soap, sanitizing, wearing masks, social distancing, and staying at home, simple as they seem, guarantee us a decisive blow against this deadly virus. The fight against coronavirus is a paradox. While on the one hand, we have a deadly virus that threatens to wipe out people and disrupt the world on a scale never before experienced, defeating it completely, on the other hand, takes such basic measures and elementary precautions. We must not be confused by the simplicity of washing hands, social distancing, and staying at home to underestimate the deadly, dangerous, and destructive coronavirus. Let us remember that the coronavirus cannot move or multiply by itself. It desperately needs our bodies for mobility, for transport from one victim to another, and from one locality to another. Curtailing our movements will completely immobilize this enemy and stop its spread. This is why we urge those who can work from home to do so, while those who must work in factories, offices, business premises, and such other areas to meticulously exercise social distancing. Employers should adopt a shift system that enables staff to work at different times of the day or on different days to minimize congestion in workplaces. And unless it is absolutely necessary, and with compelling and extraordinary reasons, the rest of us must stay at home. This is also the case for the restriction of movements into and out of Nairobi, Kwale, Kilifi, and Mombasa, counties where the highest incidences of COVID-19 have been reported. These simple steps, avoiding handshakes and unnecessary contact with bodies and surfaces, regularly washing hands with soap, sanitizing, keeping a safe social distance, wearing masks, avoiding unnecessary movement, and staying at home are the most effective arsenal against the deadly coronavirus and will be part of how we live and relate for the foreseeable future. As government, we appreciate and commend the millions of Kenyans who have taken this directive seriously and are conscientiously complying with the protocols as issued and updated by our health ministry. Those not committed to these measures should know and understand that they are putting their lives, those of their families, friends, and millions of other Kenyans at death risk. This kind of reckless negligence, ladies and gentlemen, is unacceptable. To protect ourselves, every Kenyan should go the extra mile and perform the patriotic duty of ensuring that their families, their friends, workmates, and neighbors adhere to these protocols as issued by government from time to time. We must not negotiate our safety and survival. Let all of us be our brother's keeper. Many Kenyans are, however, asking, while government is telling us what to do, what is government doing about the COVID-19 pandemic? And allow me to say the following. President Uhuru Kenyatta has taken personal charge of this situation and mobilized government at both levels, together with development partners, the private sector, and friends of Kenya, to accomplish a number of objectives. Our first key task is to assemble and provide a body of accurate and verifiable information to the public, and to work with all partners, including the media, on its dissemination so as to empower citizens to take the right decisions and make the correct choices. Information on the nature, threat, and remedies of the novel coronavirus and COVID-19 at this point in time is the foremost duty of the government, given that citizen behavior and action is at the heart of defeating this pandemic. Success stories around the world indicate strongly that effective management of COVID-19 is attributable to availability of accurate information and efficient public uptake, use, and response. In preparation for the possible escalation of the numbers of COVID-19 cases from hundreds into thousands, the government has designated and equipped different hospital and other facilities, including the 600-bed capacity Kenyatta University Teaching, Referral, and Research Hospital in Thika, while every county has been tasked to do the same with their health facilities around the country. Further, we have directed the Ministry of Education to work with counties to identify boarding schools that can be used as isolation facilities for COVID-19 cases when the situation reaches there. The government is working with counties through KEMSA to stockpile medical supplies necessary for the management of cases of COVID-19 in diagnosed persons, while the Public Service Commission is undertaking recruitment of additional health personnel, including 1,000 doctors to be advertised this week, so as to build adequate capacity to manage increased numbers of COVID-19 victims. Number 4, the statistics released by the Ministry of Health on the number of persons infected so far has come mainly from testing of persons in quarantine and their known contacts. The testing process at the moment is slow and limited. We are working with the World Health Organization and Africa Center for Disease Control on the approval of rapid diagnostic kits produced by international and local institutions, including KEMRI, to scale up our testing. I did speak to the director of KEMRI yesterday, and they confirmed to me that in a couple of weeks, they will be ready with their kits for mass testing. Once approved, these diagnostic kits will enable the government to carry out mass testing of Kenyans, which is necessary to capture all those infected by the virus for isolation, containment, and management. This exercise is critical for us to adequately and comprehensively respond and manage this pandemic. We are working with international partners, including the World Bank and the private sector, on the acquisition of additional ventilators, sanitizers, and masks, with the aim of enhancing our capabilities and preparedness. Kenya Bureau of Standards has provided standards for production of these items, and local manufacturers should produce what they can en masse without any further delay. We are also scaling up oxygen supply to all the 94 hospitals that were identified under the MES program for use by patients who may need supplementary oxygen. This crisis has completely disrupted our lives and taken away everything we took for granted. Normal is a word we have to rapidly unlearn and hopefully relearn in future after the coronavirus. Yet, if we think that our lives have been disrupted, the world of healthcare workers has been turned upside down, inside out. More than anyone else, this crisis demands that frontline health workers give not just their best, but that they give their all continuously. They have to be away from their families so that we may be with ours. They have to come into close contact with the infected persons so that we may remain safe. While all of us are soldiers in this great army against COVID-19, our generals, crack units, elite fighters at the front line are our healthcare professionals. To ensure that our community health workers, nurses, clinical officers, paramedics, laboratory technicians, pharmacists, and doctors perform their duties without them being compromised, personal protective gear is being made available and in adequate quantities to ensure sustained supply of these personal protective equipments. Local manufacturing capacity has been identified and contracted. To assist our healthcare workers who have demonstrated inspiring selflessness and diligence under extreme, stressful, and challenging conditions, let us rigorously observe the protocols set out by the Ministry of Health